Hi, I'm Todd Whitthorne, the president of ACAP Health. It's probably hard to tell, but I'm actually making vitamin D right now. Two things you need to know about vitamin D. Number one, it's not a vitamin, it's actually a hormone. We make it when the sun hits our skin. And number two, the odds are overwhelming that your vitamin D level is lower than it should be. Large studies published in major medical journals show that our vitamin D levels are dropping and that at least 77% of Americans are insufficient in their vitamin D levels, meaning their blood levels are below 30 nanograms per milliliter. The rates are even higher for those with darker skin, 90% for Mexican Americans and 97% for all non-Hispanic blacks. Low vitamin D levels were first linked to poor bone health back in the early 1900s. It's what causes a disease known as rickets. That's why dairies first started fortifying milk with vitamin D. For a while, believe it or not, you could even find it in beer. Today, though, because of thousands of published studies, we know that vitamin D is related to much more than just bone health. Increasing the amount of D in the body can prevent or help treat a number of ailments, including arthritis, cardiovascular disease, depression, chronic pain, age-related macular degeneration, 17 types of cancer, including breast, colon, ovarian, and prostate cancer, osteoporosis, hypertension, which is really just a fancy name for high blood pressure, diabetes, Alzheimer's disease, and it plays a very important role in immunity. A study published in the Archives of Internal Medicine showed that people with the lowest levels of vitamin D are 36% more likely to suffer from colds, flu, and upper respiratory tract infections. Think how that might impact their productivity in the workplace. This report from Harvard shows the association between vitamin D and breast cancer, colon cancer, fractures and falls, blood pressure, and the flu. Dr. Cedric Garland from the Moores Cancer Center at UC San Diego states that the benefit of vitamin D is as clear as the harmful link between smoking and lung cancer. Low vitamin D status is also linked to insomnia, fibromyalgia, psoriasis, and multiple sclerosis. We even have vitamin D receptors in skeletal muscle, so if you're an athlete, pay attention. It sounds almost too good to be true until you realize we're beautifully designed to manufacture vitamin D. That's why it's often called the sunshine vitamin. When the UVB light from the sun hits our skin, it triggers the production of vitamin D in our liver and kidneys. It's then utilized all over the body. Vitamin D is critical for health. 10% of the human genome is actually regulated by vitamin D. So if your vitamin D bucket is low or empty, it's impossible to operate at 100%. The best sources of D are either the sun or supplements. As you can see, it's really hard to get enough vitamin D from your diet. Even if you eat lots of fish, drink plenty of milk, or consume very large quantities of eggs or fortified cereal. Now, I know a lot of people are concerned that exposure to the sun increases the risk of skin cancer. That's true. But be careful not to throw the baby out with the bathwater. A sunscreen with an SPF of 15 or greater blocks 99% of the synthesis of vitamin D. In fact, Dr. Edward Giovannucci of Harvard suggests that sunlight might prevent 30 deaths for each one caused by skin cancer, although no one suggests getting a sunburn. A paper published in 2009 in the American Journal of Medicine recommends vitamin D supplementation over deliberate sun exposure to ensure adequate vitamin D levels, especially in fair-skinned individuals. The only way for you to accurately know your vitamin D level is to get a blood test. It's impossible for you to guess. Once tested, don't be surprised if you fall in the deficient or insufficient range. Even if you spend a great deal of time outdoors, the odds are you're low. Toxicity starts at a level of 150 or greater. It's very rare for someone to reach a level that high. As I mentioned earlier, most Americans are below 30. The recommended blood level for vitamin D is between 30 and 100 nanograms per milliliter, although many of the experts feel that somewhere between 40 and 60 is a good target. That goes for kids as well. Many vitamin D authorities suggest taking a supplement with 2,000 IU or international units per day. However, there is a six-fold variability in how we respond to vitamin D. Some people will need to take more than that. Many things will impact your vitamin D level, including your skin color, the latitude of where you live, the time of year. We make more vitamin D in the summer than in the winter, your age, and your weight. As the body mass index goes up, generally the vitamin D levels go down. When looking for a vitamin D supplement, always look for D3 rather than D2. And all brands are pretty much the same. And the really good news, vitamin D is really inexpensive. The 3D Daily product offered by ACAP Health through 3Care Therapeutics provides 2,000 IU of vitamin D3 along with an appropriate dose of EPA and DHA in a purified omega-3 fish oil. If you'd like more information, a great resource is the Vitamin D Solution by Dr. Michael Holick. He's one of the real gurus in research, and he's published hundreds of articles in the medical and scientific journals. So whether it be from the sun or from supplements, make sure that your vitamin D bucket stays full. If you would like to learn more about the 3D Daily product or how the ACAP Health Corporate Supplement Program can benefit your organization, visit acaphealth.com. You can also reach me directly at twhitthorne@acaphealth.com or by calling 214-706-5471. Stay well.